Welcome to 52 Questions. I am Shannon Weber, Director of HIVE. Every year, HIVE receives hundreds of questions from patients, their partners, and providers. We're bringing you one of those frequently asked questions each week in video format in 2018. I'm here this week with Dr. Adimora. And the question for this week is, who should get the UequalsU message and what impact do you think it will have?
Okay, great. Well, thanks for having me. And I guess the first question is, what is U=U? So U=U means undetectable is untransmittable. And the concept is that people whose viral loads for HIV are consistently below detectable do not give HIV sexually to other people. And that's a really important concept. It's important for a lot of reasons because it emphasizes for people's own personal health just how important it is to have their viral load below detectable. It's also important because it makes it clear that you're really not going to give HIV to sex by somebody if your viral load is below detectable and if it's consistently below detectable. And that makes a huge difference in how people see themselves, you know, in their self-image, their self-esteem. And this concept alone, this dissemination of this concept can go a long, long way toward decreasing stigma that's related to people with HIV, particularly internalized stigma and also external stigma. It's important for everybody to understand this concept. It really, really is. So who ought to be talking about this is providers, you know, doctors, nurses, just making sure that their patients know this concept, that they understand it, because a lot of people don't really know it. It's been known in the medical community for quite a while, actually, at least since the results of, you know, HPTN 052 were published, that study that showed that people who are below detectable don't give HIV to other people. But it really hasn't percolated quite as much through the community as one would have hoped. You know, the dissemination of this concept is so super important because this is actually, in effect, a structural intervention to decrease stigma. And guess what? It's free. It's not like you even have to spend a lot of money to disseminate this concept. Just letting people know that doing that alone is super important.
Awesome. It requires changing our mind and changing our language.
Exactly, exactly.
Fabulous. All right, join me next week where I'll answer the question, how does U=U impact reproductive justice?